At Cleveland Clinic, we're passionate about caring for the communities in which we live and work. Today, I am pleased to speak with our Chief Community Officer, Vickie Eaton Johnson. Vickie, thank you very much for joining us.
Thank you. I'm happy to be here.
Vickie, tell us a little bit about yourself, your story. You live nearby. You're a true Clevelander. You've been with the Cleveland Clinic for quite some time, and you care deeply about the community. Tell us a little bit more about it.
I do care deeply about the community because it's my home. It's where I lived for 30 years, a few steps from main campus.
That's wonderful. So this is a neighborhood, but this is also a neighborhood that is so close to your heart.
Absolutely,
and ours.
Yes.
There are so many unmet needs in the communities that we serve. Can you tell us a little bit more about the priorities for Cleveland Clinic when it comes to our service to the community?
So first of all, we engage with the community. We ask them what their needs are, and we respond to that. So through that process, we engage with local governments and public health agencies and the people. We hear from them on what their needs are. We put that all together and we prioritize. And what we found is that the issues that are most prevalent to the community are global issues. They're national issues. So food security, hunger, childhood hunger, infant and maternal health, and lead poisoning are major issues, not only in Cleveland, but around the country. So the fact that we've named them, our priorities allow us to have a global impact in the work that we do.
What are we doing to actually address those priorities? Can you speak a little bit about our concrete actions?
So it's important that we recognize none of this can be done alone. So we partner with the community to do the work. So a really concrete example is that we've made our first investment in Let's Save Cleveland, and in less than 7 months, we know that more than 200 of Cleveland's children are living in lead-safe housing. That's real impact. We know the outcomes of lead poisoning, and to know that we're preventing that from the future is significant. With infant and maternal health, we know that Black and brown women suffer at a different rate than white women, and we are obligated and we're committed to address those disparities. We've established a Center for Infant and Maternal Health in the Women's Institute that targets health equity. We've hired community health workers. These are fantastic women, primarily women, who live in the community, who have been trained and certified to be a health worker. These are women who stay with our patients and the babies through the first birthday. And we know we've addressed all those social needs in the time that we spend with them.
That is really, really good to hear. We said a lot about our immediate community here around the main campus, but obviously Cleveland Clinic has grown and we touch many communities around the world. Could you please speak a little bit about the community initiatives outside of Cleveland?
Community is important everywhere we are. We have the same conversations, we partner with the same levels of government and nonprofit partners, and then address those issues. So in Akron, for example, hunger and food security is an issue. They have not one but 2 food pantries where they serve the community and patients there. They also work with infant and maternal health. They have a plan to expand the services and to use the shared medical appointment model to address the disparities that happen. So imagine women who share lots in common coming together to learn, to hear, and to address those issues together. So Akron is doing a wonderful job. They've also partnered with Goodyear as both anchor institutions in that community to think about workforce development and how can Goodyear and Cleveland Clinic Akron together attract young people to fill both the needs that we have with workforce.
Yeah, that's a great example of partnerships in a community that Cleveland Clinic has to address some of the needs, because we cannot address every need ourselves.
We cannot.
Could you please speak about what do we intend to do for our communities in Florida?
Yes, Florida is much like Ohio in terms of the community health needs that we've learned through assessments. One example would be our K through 12 education initiatives. We've always worked as one system. We've shared our best practices, and what we've learned has been duplicated there in Florida.
I have absolutely no doubt. So once again, thank you so very much for the work that you do, and thank you very much for being here.